Good evening and welcome to IHW Council's special web series on women's health, START, supporting treatment in assisted reproductive therapy. I'm Anisha Nair and you're watching our exclusive show on women's health supported by Bharat Serums and Vaccines under its public awareness initiative. The COVID pandemic has put the spotlight squarely on our health. The arrival of the vaccine and the start of the inoculation process has brought hope to millions who want to stay safe and return back to the pre corona days. There are many others who find themselves in despair as some of their dreams may have suffered a setback because of the many restrictions of the lockdown and the fear about COVID 19. I'm talking about couples who dream about starting a family but are unable to do so because of infertility. Infertility over the years has emerged as one of the most common health issues that many young couples have been facing. According to the Society of Assisted Reproduction, infertility currently affects 10 to 14% of the Indian population. The scenario is even worse in cities where every one in six couples is impacted. Our show today is special as we're going to discuss all aspects related to fertility and IVF treatment. Bharat Serum and Vaccines Project START is an initiative that aims at providing support to couples beyond medicines with initiatives like microfinancing the treatment and counseling. Project START encourages couples to stay on course for IVF treatment to achieve the goal of parenthood. Today, we have a very special person joining us who will help answer all your questions regarding infertility and its treatment. There may be many questions in your minds on what you should do to succeed in starting a family, and our expert will help answer all your queries. Please welcome Dr. Rituparna, Director, Ramkrishna IVF Centre, Siliguri. Welcome to the show, Dr. Das.
Thank you, and good evening, everyone. So let's start the conversation.
Yes, but before we start the conversation, I would like to request our online viewers to keep sending us their questions in the comment box. This is your golden opportunity to get your questions answered by a renowned IVF doctor, and we'll try to answer as many questions as we can over the next 25-30 minutes. Do like and comment with your feedback, and do share this page with your friends if you think that they will benefit from this. So, Dr. Das, thank you so much for being with us. Now that we're opening up, I'm sure more of your patients are also coming back to the clinic. But when it comes to infertility, and some people think they can still afford to wait and perhaps delay parenthood. So, what would you like to say to couples who may be on the fence, who do not know that they have infertility, but they have just put off a family for some time? What's your advice?
Okay, so for me, it's always the age of the female partner. It's very important, So if the female partner is like more than 35, because see, all of us right now, what we are doing, we are finishing a career, and then we're getting settled, and then we are getting married. So the age becomes a very important indicator, a very important prognosis for the success of any treatment that we do. So if you are age 35 or above, then don't delay it. I mean, just and if you are like trying for pregnancy, maybe for 6 months and not getting pregnant, then do seek help immediately. And somebody who is, and there's another factor also. There's two things which for me it's very important. For me, it's the age of the female partner, and the second thing is the duration of marriage. Now, if there's even a young girl, like if she's 28, 30 years, but she's married for like 7 years, and they have been trying since that time, but they're not getting pregnant. So then it's also something which you need proper treatment, where you need to consult a doctor.
All right. So you're saying for people who have been trying for many years, they may be young, they should consult a doctor and not put it off for too long. What about some people who, some families who may have cases of secondary infertility? They have a child, and they have been busy, with the child, and they haven't consistently tried, and then they feel that something's not working out. But then the age has really caught on. The women are more than 40. what to do at this time? Should they still go ahead plan for a child? Can women bear healthy babies after 40?
Okay. So yeah, this is a very important thing that is coming up these days, because a nuclear family, the mother has to take care of everything, so they don't get such time. And with the kind of lifestyle we lead these days, everybody is so busy and tired. So then they can't plan, but suddenly they feel that, okay, I need a second baby, now I should try. And the age is, as you told, that it's already 40. So, but still, I think they should immediately seek a help, try. There are lots of method, for which they can conceive. And I always say that people who have become the female who have become pregnant have a greater success rate than people who have never become pregnant. So they can always seek help and they can try. But now, when it comes to the age factor and the abnormality of the baby, yes, with the age, some genetic abnormalities do increases. But see, now we have a lot of tools. There are a lot of tools, lot of new technologies are there with which we can easily identify the things. So, but still, if they want a second baby, and I always feel that you always need a second baby, because the lonely child, they always need a company. The parents can't be that friend that a sibling can be. So it's always never too late to always start for another baby and try to take help and all, so you can help them.
Right. Dr. Das, you spoke about new technologies that have come. Of course, technology is helping women to conceive. But because of age, the risk of chromosomal defects is high. So, how does technology help there? Can it fix the chromosomal defects? Can you find out how does it help there?
No, nobody can fix the chromosomal defect. So nobody is God. Nobody can fix a defect, but we can detect it basically. So now with the event of this IVF, there is also one technology which is called the pre-implantation genetic screening. So PGS that we call. So with that thing, you can actually find out that which embryos are good, which are like not chromosomal abnormality, where what we call euploidy blastocyst or for embryos, that we can find out. So with that, if you see that yes, this embryo is good, it doesn't have any as such chromosomal abnormality, then we can transfer them. But even if with that also, like once patient conceive, that's what we do routinely. Somebody who's getting pregnant normally, spontaneously, at 12 weeks, at 18 weeks, a lot of tests are there, to see the genetic abnormalities, because there are few chromosomal abnormality like Down syndrome, there's Patau's, there's Edward, which are routinely screened, which are routinely screened. And if you are detected, we can do a lot of like amniocentesis are there, a lot of technologies are there, which can help you. And if it is so, you can terminate. You don't have to wait till till 8 months, 9 months of pregnancy. So that's what I want to say. So there are technologies which you can understand before only that whether this chromosomal abnormality is there or not.
All right. So you have the science available to help you, stop before you can transfer a embryo which is not chromosomally fine. Dr. Das, we've started getting a few questions from the audience, and if questions are coming in, we are happy to answer as many as we can. So one Facebook user is asking, can HIV positive women go for pregnancy or IVF treatment?
Yeah, HIV woman can't go for pregnancy. But basically we need to see her CD count, which is like her, basically the immunity and how the status is. Yeah, IVF also you can go, but it also depends that for this HIV patients you need a separate lab and all. So you can go for it, but you need a separate lab and all. So you can go for pregnancy. It's not that HIV can't become pregnant.
You're saying
In my
natural
own clinic,
pregnancy.
Natural pregnancy, I won't say that, because natural pregnancy carries more of risk. So you can go for like assisted reproductive, like IUI, IVF, those can actually uh, decreases the load. They can't guarantee you, but then they do decreases the viral load. But first you have to see that what is the condition of the uh, patient. I mean, how is her viral load, whether she's
Dr. Das, you were mentioning the viral load, but do all IVF centers routinely have separate labs for HIV positive patients? Because it must,
no.
as I
It
understand, that this is a basic blood
yeah,
work that all patients
yeah,
have to undergo. So you will come to
yeah,
know
yeah,
about the status. So
yeah,
if a person is
yeah,
already knowing it's his status and going for treatment,
yeah,
what is the recourse for
yeah.
them?
Madam, pardon once more, what you were asking?
So, as a patient who is HIV positive, they know their status, but they are seeking treatment. How many centers make it possible for HIV positive women to undergo infertility treatment?
See, I'll tell you, I haven't got any female HIV positive patient, but I have got a lot of male partners are seropositive. So recently also, so what I do to them, I tell them, advise them, because female are negative and male are positive. So I advise them not to have intercourse, and even if they can have intercourse, but I tell them to use condom, better. And what I do for them, I do the IUI, because that decreases the viral load, and that also there's almost nil, transmission of viral load to the baby. So I do offer them IUI.
All right. So, fertility treatment is
And
possible
for
for.
IVF, yeah, treatment is possible. It's possible.
Yes, please tell me what were you saying about the IVF treatment?
Yeah. So IUI, we do offer them IUI. I for IVF, I haven't got as such any patient. But the American college, they do say that you can go for the thing. You can go for the pregnancy. That is not a problem. The only thing that we are worried, because we need a separate area, for this patients, when we're doing the pickup and when we're doing the fertilization and all that. So that can be seen, but you can go for the pregnancy. It's not that you can't become pregnant or something.
All right. We've received another question from a Facebook user who's saying, both my fallopian tubes are blocked with hydrosalpinx. Can I get pregnant naturally?
Okay. Now let me explain you what is hydrosalpinx. So we have two fallopian tubes which are attached with the uterus. So what is the function of fallopian tube? So fallopian tube is basically, it is like a bus. It takes you from one place to another place. So suppose you're traveling from Mumbai to Pune. So it's like a bus. So what happens now, if the the function of fallopian tube is to transport egg and sperm and help them in fertilization. Now, hydro means water, and salpinx means, we could call it a fallopian tube. And if there is a pus, if there is an infection, if there is a water which is not normally present in the patient, so then there is a problem. So if you have bilateral on both the side fallopian tube, you have hydrosalpinx, you have water, or you have pus, whatever you have, if you have, then natural pregnancy, see, I never say that it will never happen, but it is very less chances, because your tubes are not working properly. So inside the tube, there is this lining. There are the hair follicles. The way we have hair in our body, there's small hairs. Like inside the nostrils also we have hairs. So the function of the hairs are to sweep them, sweep the egg and the sperm and then bring them together. So if that is not working together, then the fertilization will not take place, the pregnancy will not take place. So if somebody has bilateral hydrosalpinx, it's better they do go for laparoscopy, and they can for surgery, and they can get confirmed that whether they have really bilateral hydrosalpinx or it's just a swelling. And if requires, they can go for tubal clipping, and then they can, if it is one is good and another is bad, depending on the condition of the tube at that time. And then they can try naturally if the one tube is fine, another is like thing, or they can go for IVF. And if
So you're
somebody
saying,
is like, no, I don't want to try, I don't want to do laparoscopy, they can directly also can go for IVF.
but you're saying that if it is a confirmed state where both tubes have heterosalpinx, the only option is IVF. There is, no other fertility treatment that can be done, right?
Yeah. Hydrosalpinx, no. What I'm saying, you see, a lot of time we get hydrosalpinx, we can't see tubes normally. Okay, that's the thing normally. So when we can see tubes and there is a fluid in that tube, that's why we can see over ultrasound, or maybe it is HSG. You need to confirm it. Now, how to confirm it? You can confirm it by laparoscopy. So
Okay.
what is the advantage of that once you do laparoscopy, if you require, you can do the treatment. I mean, you can clip it. And if it is not there, then you can just try naturally. But if you are trying naturally, and sometimes it's just an infection. So maybe, so natural pregnancy, for that, you need to confirm it before trying for natural pregnancy. Confirm it that whether you really have hydrosalpinx or not. And if it's there, then you need correction.
All right. Another question that we have is azus permea treatment possible through IVF?
Okay. So a lot of patient comes to me a lot of men come to me and they say that azus permea, and is there any medicine? Unfortunately, there's no medicine. I mean, azus permea means there's no sperm. So either it is blocked somewhere or it is not forming. Either or. Either there is a blockage, the pipe comes down, there is a blockage at the site, or the formation is less. So what should I do? Is there any medicine? Unfortunately, there's no medicine. Please, there's no medicine. So what we can do, we can give them injections. There are some injection, there are some hormone injection, and seeing the thing. And you have to go for IVF. If you really want your own, you go for IVF. Don't do delay. Go for IVF. But patients are not aware. A lot of people are not aware, and they start hearing to the family members, because in our Indian scenario, it's always wherever you stay, however it is, it's always like the family will, no, 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 you go to that doctor. We have done it. Or maybe it is the rural population which will be like going to this Ayurvedic centers and all, but it will not help you. It will not help you. So if you as a spermia, go for your hormones, check what is the cause. If the cause is find out, then you can go for that particular treatment for that. If it is not happening, please go for IVF. Don't do too much of late, because a stage comes
Okay.
where we can't find sperm.
Dr. Das, IVF for a man who has azoospermia is possible, or is there going to be donor sperm
Yeah,
here?
it's possible. It's of course, sir. It's of course possible. It's
All right.
possible.
All right. So IVF is a
It's
solution for
possible.
azoospermia. We have another question
Yeah.
which is coming from a user, a Facebook user, who's saying, I had two failed IVFs. Is there the possibility of the third attempt being successful?
Okay. So this is a very big question, because I don't know anything about the patient. I don't know what kind of embryos was it. So a success of IVF depends on a lot of things, but I will summarize into 3 points. The first and the most important is the quality of embryos. That is the most important thing. If you have a fantastic kind of embryo, the doctor is saying, wow, embryo, but still you are not getting pregnant, then you need to see the endometrium, where the lining of the uterus, maybe that could have some problem. So the first thing is the embryos, the second is the endometrium, and third is the skill of the doctor who is transferring it. But I think because somebody who is doing a transfer every time, it's like everyday job, that person's everyday job. So I'll be sticking to move 1 and 2, that is the embryo. And if the embryos are good and still she's not getting pregnant, then it could be the endometrium factor. But that you have to see that what was the cause, why did she fail first two, that we need to see in details.
Right. We have another question. This lady says, I'm a 38-year-old woman. I had 3 miscarriages in the last 4 years. Each time I conceived naturally. Do I need to opt for IUI or IVF?
Okay. So basically, these patients are called they are basically recurrent pregnancy loss. Now, recurrent pregnancy loss, can I know that which month, like first 3 months she had miscarriage or after that? Can I get that information? No.
We haven't got those details here, but we only know that she had miscarriages.
Okay. So if it is first 3 months, it's mostly because of the chromosomal abnormality. Now, for the chromosomal abnormality, first 3 months you are having a miscarriage, then definitely you should go for IUI. Doesn't play much role. IUI doesn't play a role in recurrent pregnancy loss. You can go for IVF because in IVF, I told you about the new technology. There's a PGS, pre-implantation genetic screening, where we can screen the embryos, where we can see which embryo is chromosomally good, and we can transfer them. So you can go, and if it is like after 3 months, then there is some problem with the uterus. So you should always go for like a hysteroscopy, see if there is any septum, see if there is any problem with the uterus, and then of course you can go for the rest of the treatment.
The other question that we have is, after the first dose of IVF injection, the egg ruptured in 9 days. What could be the reason?
See what happens. This is sometimes what happens, that when the eggs are not very good quality egg, or there is a female, usually they are towards a low ovarian reserve. That times happens if sometimes because we need to maintain that the injections are given to prevent the rupture. So sometimes it happens, sometimes also with the batch of the injection happens, sometimes with the person who is giving you the injection. But mostly what happens, instead of doing everything, you have a rupture. So that is mostly, it's because of when women are going towards, they're not maintaining such kind of plateau where you require to keep that intact.
We have another question, which a Facebook user is asking, not all can afford IVF treatment. Are there cheaper treatment options available?
Yeah, of course. See, if you have as such, no problem. Why don't you try normally? If you can't try normally, you can go for IUI. But IUI is like, what happens in India, IUI is given a big hype, but IUI is a very simple thing, We just facilitate the transport of this sperm, We just decreases the time or the length, to reach the fallopian tube, to reach the egg. So even sometimes what happens when patient been doing a lot of treatment, have been taking drugs, have been trying together since a long time, but not conceiving, even maybe sometimes IUI helps it. But otherwise there is, and also you can go for, maybe a laparoscopy to see if the tubes and all are good, and then you can try naturally.
And how much would all this cost, getting a laparoscopy or an IUI, and on average? Is there a ballpark?
See, IUI will cost you roughly 10 to 12,000. Okay, that is thing, and laparoscopy will depend upon like 20 to 25,000, depending on the cities how they take, roughly like that.
All right, Dr. Rituparna, thank you so much for joining us today and answering all the questions that you've taken up from our viewers. So if you have questions, do keep sending them to us, and our experts will be happy to answer all your queries. Thank you so much, Dr. Rituparna, for joining us on the show today and answering all the questions that you have.
Thank you everyone. Thank you especially Bharat for giving me this opportunity. Thank you.
And if you have more questions, you can send them to us through WhatsApp. Do use it to click on the WhatsApp button on our page, and Don't forget to follow us to stay updated on all that concerns your health and well-being. This program was supported by Bharat Serums and Vaccines Limited under its Public Awareness Initiative. We will be back with our special show on women's healthcare next week, the same time. Do follow us on Facebook to get all the updates on our upcoming programs. So keep sending us your questions and we will definitely try to include them in our next show. Till then, stay at home and take care. Goodbye and see you soon.